Chalo. Yeah, good afternoon. Yeah. So like last class I spoke a very simple remedy. Apocenum. So any quick questions in apocenum? Yenadru keladideya apocenum alli? It's a very small remedy. If you remember, we mainly focused on a simple area, and that was dropsy. So, and we also compared few similar remedies to apocenum, and mainly we focused on Apis mellifica, digitalis, yes, arsenicum mal, lycopodium, yes, good, few remedies. But the main concern is apocenum is predominantly a remedy for dropsy. Okay, that's what we try to conclude in the end. Okay, so now if apocenum is clear, I'll start with a very small, I told you I thought we'll finish the small remedies first and then we will focus on the polycrest remedies. That was the plan. So we'll continue with one more small remedy. Okay, now this small remedy that I am going to discuss is a remedy which mainly belongs to an acid group. Okay, I have given you the acid group, I have given you a small clue. See, when you look at acids, fine, okay, you are reading the question, okay, fine, good. So what is the question here? Recall the common acids we use in homeopathy. Acid phos, acid fluor, muriatic acid, very good. Oxalic acid, sulfuric acid, okay, good, very good. So there are plenty of acids we use in homeopathic materia medica. Okay, and I hope you are also introduced to group study, which was the last group that, luckily it is acids. Very rarely things go hand in hand, and luckily acid groups are told to you, and today I am starting with an acid. So you will understand acids much better. Okay, so now that if acid groups are over, one more question that comes up. What are all the common characters of an acid? Okay, I mean, no, one second. Yeah, 1 second, one at a time. Debility, very good. There is corrosiveness. Broken constitution. Okay, very good. Hemorrhagic diathesis. So probably, good. See, probably this no is affecting my hearing. Probably I am not able to hear much better. But what I have understood here is they are constitutions who belong to broken down constitution. I will tell you what broken down constitution is. And we also have debility in them, very good. There is corrosiveness, if I am right, I heard it right. And somebody was talking of hemorrhages, weakness, okay. And majority of the acids are chilly acids. Which are the hot acids? I have already shown my finger. Only two acids are hot acids. Rest of the acids are all chilly acids. Okay. Like for example, nitric acid, whatever other acids you spoke of, sulfuric, acidic, all those acids are chilly. Only fluoric acid and picric acid are hot. And majority of the acids, they look very lean, thin, weak, and that is what gives you an appearance of broken down constitution. As if there is no life. Everything has ended. Fine. That is the kind of look you get in acids. It's a common question asked for third years. Describe the general characters of acids. 5 mark question. Okay. And today we will start with a very important acid. Any wild guess which is this acid? Yeah, I know it's a chilly acid. Good, agreed. And this we also use in majority of our Chinese dishes. Vinegar. Acetic acid, very good. See, vinegar is a very diluted form of acetic acid. Fine. We all use vinegar. Done? Allah. So many of our dishes has vinegar. Okay. We'll continue. We'll talk of acetic acid. Now before I get into the class, what do you know about acetic acid? Okay, there is hemorrhage, good. The voice was loud and clear. Good, good, agreed. I am not asking you the type of hemorrhage, from where hemorrhage. It is my duty to explain. It's my first class about acetic acid. I am happy you spoke of hemorrhages. Good. Apart from hemorrhage, what else? What else do you have in acetic acid? We spoke of apocynon in the last class. And apocynon we saw dropsy. And what was the tagline? Dropsy with thirst. Dropsy with thirst. One more remedy that should come to your mind when we talk of dropsy with thirst is acetic acid. So there is dropsy, there is hemorrhage, we will discuss, we will go slow. And if you read the introduction to acetic acid in Clark, he says how the people who are working in acetic acid industries, how they developed symptoms, okay, fine. And he also says a very fat lady, to reduce weight, she took acetic acid and in a month's time she expires. She lands up with some complications and she dies. Okay. So acetic acid, is, as you know, it's an acid. It's a acid which mainly has a physical appearance similar to majority of the acids. Meaning they are thin, they are lean, they are weak, they are debilitated. Sunken eyes, as if there is no life. Yeah, broken down constitution. So this is the typical appearance of acetic acid. Any acid you can write this physical appearance. It's almost common. They look very weak, debilitated. Now what else you have in acetic acid is, what are all the ailments? So now if you again go back to this question, what are all the common ailments in acids? Under generalities they would have told you the common ailments of acids. Okay, very good. Loss of sleep. Don't look into your books and answer. And after anesthesia, loss of vital fluids, good. Abuse of narcotics, good, very good. Loss of vital fluids, dubara, physical exertion, mental exertion, good, good. Yeah, I'm happy. There are a set of ailments common to acids. Okay, we'll just try to understand what are all the ailments you have in acetic acid. Okay, ailments which comes from injuries. What is this? Ailments which comes from injuries. Now, as a third year student, you know so many remedies for injuries. Yeah, very good. Calendula, okay. Arnica, ledum, bellis, hypericum, ಬೇರೆ ಏನಾದರೂ? See, we'll not look into the differentiation. See what happens now. If we get stuck with differentiation, then we can't go ahead with acetic acid. But having told, arnica has its own indications in injury, mainly for bruises, blows, okay, contusions. Agreed. Ledum, one word. Beautiful, good. I like that voice. I like that sound. Punctured. When you have something sharp getting, when it is trying to injure you. For example, thorn. For example, nail. Anything like that. For example, I always give you this example of lancet. Lancet itself in your physio lab. Fine. You know how boys, I assume majority of the boys did not have fear, but then generally, it reminds me of a small incident. I don't know if I've shared it before. Same college, we had one of our friend, a very good friend of ours. First day of our hematology, physiology lab. So blood was drawn. Okay, somebody's hand, blood was drawn, and then we heard a huge sound, thud, and one girl had fainted looking at blood. Her blood was not removed. Okay, somebody else's blood was removed, and our sir was explaining which vein, how do you take blood and all those things. So just seeing that, one girl, fat girl, and a huge sound, so she just fainted. Okay, so like for example, pricks, lancets, injections, anything that is sharp and it is causing an injury, you can think of ledum. Similarly, bellies, somebody spoke of bellies. Deep injuries, abdominal operations, abdominal surgeries. After that, deep abdominal surgeries, you can think of bellies. And then hypericum. Again, if you are a lover of Kent Materia Medica, fine. I mean, he beautifully explains hypericum. For example, he says, accidentally you keep your finger in between the door and it slams. So what happens? The nerve, the fingertips and all, they're having good nerve supply. If that gets affected, he says hypericum. Beautiful remedy, hypericum. Okay. Any other remedies we spoke of? Cantharis. Now, when do you think of cantharis in injuries? Yeah. Anyway, cantharis, more than injuries, it is burns. I mean, I was just speaking to Sharnappa sir, your pharmacy sir, when I wanted to explain cantharis for your junior batch, he was narrating an example. Beautiful remedy for scald. So he was trying to tell one of the, I don't know who that homeopath was, he would keep his hand in the hot water and then he would immediately keep his hand in cantharis solution, meaning mother tincture. That's the kind of confidence he had. Not that purposely he would keep. See, I am keeping it here. See, scald. See, cantharis. And he was so confident about the therapeutic value of cantharis in scalds. So he would just purposely do it. So scalds or first degree, second degree of burns, please do think of cantharis. Cantharis is already there in the YouTube. We'll just see, if time permits, we'll take it up again. Okay. So we'll get back. First part was injuries. Now the question. Why did we compare all those remedies? To give you a clarity where and when acetic acid is indicated in injuries. You are getting my point? Yes. Otherwise we all land up with what? Confusion. Sir, injury, arnica में भी है, ledum में भी है, berberis में भी है. Okay, announcement 1 second, थोड़ा off कर दो. वो ऐसा press कर दो. Okay, चलो. Yeah, we'll get back. Okay. See, like I was trying to tell you about injuries. See, why I was trying to explain this in detail is, so many remedies as a third year student will come to your mind when we use the word injuries. But see the beauty. Every remedy has a clarity. That is what I want you to understand. Please don't use the word confusion. Sir, injury, so many remedies. Now that is the beauty of homeopathy. Individualization. Every remedy is individualistic. Every remedy is special. So what you need to understand is, now the question comes up, when acetic acid in injuries? That is the question. Now what is the answer for this question? So after injuries, which in your common indications or general indications of acid, they would have discussed if there is weakness after injury. So acetic acid is not per se given for injuries. So after an injury, it is an after effect. After an injury, if you start feeling weak, okay, then the remedy is acetic acid. Then the remedy is sulfuric acid. So prostration which comes up after an injury is acetic acid. This question might come up in your viva tomorrow. Give me the indications of acetic acid in injuries. Sir, I know arnica. Can I tell ledum? This is how generally we come up with. But you also should remember, acetic acid has its own indications in injuries. Okay. So anesthesia. Somebody rightly said a while ago that acids are given for bad effects of anesthesia. Again the same question comes up. What happens in acetic acid after anesthesia? Okay. Like for example, some surgery is happening like spinal general anesthesia. Okay. And after anesthesia, if there is a bad weakness after anesthesia is acetic acid. Okay. In brackets, you can also add phosphorus, bad effects of anesthesia. Phosphorus. You can also add ammonium carb for bad effects of anesthesia. Anesthesia, and one more thing is bites. It should have come below injuries, bites, any bites, insect stings, bites, you can think of acetic acid. Again, it's more of weakness. Bad effects of tobacco. Bad effects of tobacco. In acetic acid, they will have headaches. Headache after tobacco. Headache after tobacco, the remedy is acetic acid. So, moving ahead, you have ailments from alcohol, ailments from grief, and ailments from vexation. The last two ailments are the ailments to do with mind. Okay? Are the ailments to do with mind. Fine. So, it also indicates that acetic acid has some amount of mental symptoms. We'll explore that. Okay. So, as promised, I have got the notes. So, please keep your pens down, fold your books, focus on the class. Unless you feel, sir, writing will help, I'll leave it to you. But notes, I've just got it so that you can take a pic and give it back. Okay. So this is the first slide, simple slide, which talks of introduction to acetic acid. Glacial acetic acid is the common name. Okay. It belongs to mineral source, trituration, ailments, physical appearance. See now, acetic acid. One second. Oh. Yeah. I made this slide in a very short duration. I thought of using blackboard and chalk, but then so what is the disadvantage here is the animation is not done. Okay, so everything is exposed. So there will be no suspense, there will be no surprise, nothing. Okay, but anyway, we'll try to understand. So what I have done here is next 20-30 minutes I'll try to cover acetic acid. It's a very deep acting remedy. We need 2 to 3 hours. But keeping the third years in mind, I am cutting it short and I am giving you what is important. Okay. So somebody rightly said acetic acid, they said hemorrhages. Okay. I will run this slide a little later because it's all exposed there. So what you need to understand is when you use the word hemorrhage, what comes next? What comes next? No. I mean, what is the next question that should come to your mind? Where? Very good. From where? From which part do you have hemorrhages in acetic acid? Good. First question. Where? Second question? How much? How much? This much? This much? Okay. So, see, we don't have a scale to measure mild, moderate and severe, but don't worry. Yeah, that's also a point. It's a valid point. I'll come to it. So, first thing is where. Fine. And second thing is what is the character? Under character, is it scanty? Is it profuse? Is it dark? Is it bright red? All those things will come. And is the hemorrhage associated with some other complaints? Are you getting this? Yes. So I am not typically explaining acetic acid from head to toe. I am giving you the important points. And first important point was hemorrhages. Okay. So hemorrhages from where? Fine. All the RFS. Okay. Fine. One of your friends says, sir, risk free. Instead of naming one, all. From many orifice. Okay. Chalo. We'll make it simple. What you need to understand is it has epistaxis. Okay. Fine. Acetic acid has epistaxis. Epistaxis in acetic acid is after a blow. Okay. So there is a blow, fine, and then the nose starts bleeding. So this is what we call it as after a blow. Fine. Quickly, other remedies. Yeah, very good. See, one remedy, when I use this now, one remedy that should come to your mind is arnica. Ailments after blow. Fine. So arnica is one. Second remedy is elapse. Elapse is not there for you right now, but do remember, nothing wrong in knowing. Okay. Elapse. And third remedy is hemamelis. There are 5 remedies: arnica, elapse, hemamelis, acetic acid. I am not able to recall one more, but anyway, remember this. Epistaxis after blow. Good. Now, for example, going lower down, you will have hematemesis in acetic acid. As a third year student, I want you to understand, why do you have hematemesis in acetic acid? You are a surgery student, fine? Yeah, I know, not much of surgery is over, you have just started your third year. But what could be the cause for hematemesis? Very good, beautiful. There is something called as APD, acid peptic disorder. Good, good. Yeah, so one reason could be peptic ulcer. Second, commonest that we have missed here is cancer. Cancer. Malignancy. CA, however you want to tell. So, in acetic acid, hemorrhage could be from the nose, and what is the cause? Cause is blow. Or hemorrhage could be from the stomach. What is the pathology? What is the cause? Cause could be ulcer, somebody rightly said, and cause could also be cancer. Okay, so with cancer, when there is hemoptysis, okay, you can think of acetic acid. There are many remedies. I'll also try to give you the indication of acetic acid a little later. So 2 points you have understood. Bleeding can happen through nose, or bleeding can happen from the stomach, meaning they can vomit blood. Similarly, they can cough out blood. What is it called? Hemoptysis. One common cause for hemoptysis as a third year student is tuberculosis. Fine. So lung pathology, tuberculosis can give rise to hemoptysis. Or there can be hemoptysis, there can be melena. There can be bloody stools, which mainly comes from intestinal pathology, ulcerative colitis or something like, or cancer of stomach, cancer of intestines, possible. Okay. Or there can be metorrhagia. Okay. Metorrhagia after delivery. After delivery, the bleeding is not stopping. There is excess bleeding. It could be acetic acid. Okay. So one point that you have understood is acetic acid is one of the important remedies for hemorrhages. Hemorrhages mainly coming from nose, from the stomach, from the intestines, from the uterus, uterine pathology. Okay. And the bleeding is dark. Many acids they have dark hemorrhages. Majority of the acids they have dark hemorrhages. Okay. So we'll just see here. This is what I was trying to focus. Hemorrhages from nose, stomach, bowels, lungs, stomach, uterus, or from the ulcers. We saw one of your friends said peptic ulcer, or it could be ulcer on your skin. Possible. Agbodu. And hemorrhages which is associated with weakness, bad prostration, an acid character, and hemorrhages which can give rise to anemia. Hemorrhages which give rise to anemia. So this is related to hemorrhages. Clear? All of you in there? We'll go ahead. So now we'll look at the second point. Now this again is exposed. So what we are trying to understand here is acetic acid is a beautiful remedy for cancer. We already discussed. Which cancer? Yeah, it's a very good remedy for CA stomach. Not only stomach, acetic acid can also be a cancer remedy for epithelioma of lips, cancer of lips. Two areas where you see cancer in apis. Acetic acid. One is lips, the other one is stomach. Okay. Now in stomach, because of cancer, what happens? One we have already discussed. There can be vomiting of blood. Or there is burning pain. Bad burning pain. After this burning pain in the stomach, there will be sweating on the forehead and skin will become cold. Please focus on this point. As a surgery student, tomorrow when CS stomach is done, there is something called as the homeopathic part. What is it? Therapeutics. That is where your knowledge of materia medica plays a beautiful role. And mind you, you have 100 marks for therapeutics. Correct, Allah? Fine? Okay, so please do focus so that you will have clarity. So tomorrow under CS stomach, if they are asking you the indications of acetic acid, you already know that acetic acid causes CS stomach, it will cause bloody vomiting, there is burning pain. After burning pain, what happens? Sweating of the forehead and coldness of the skin. This is what you need to remember. Probably this is what I also tried to type here. So we'll skip this part so that we can focus on the other area. So one hemorrhage, and second thing is cancerous affections. Now third, what is also very important here, anyway this you can, this will not worry because nothing is written there. Animation is not done. So what you also have to realize is acetic acid is a beautiful remedy for wasting diseases. What is it? It's a beautiful remedy for wasting diseases. Now the question is, ಏನು wasting diseases andre? See, English. If you know basic English, this becomes very easy. Wasting diseases. Don't tell me, sir, the diseases which are waste. That is not what it means. Allah. So what does it mean? Very good. Where there is wasting. Wasting of what? Wasting of the muscle and wasting of the fat. And probably that's why, how is the acetic acid person looking? I didn't tell acetic acid is obese. You getting my point? So what you need to understand is the leanness, the thinness, okay, the emaciation, all comes here because it is a very well indicated remedy for wasting diseases. Okay, so remember this. Now the next question, we can't stop it here. Can we stop it here? Why we can't stop it here? Because I have told you the meaning of wasting disease. What should be the question that should come into your mind is, what are wasting diseases? What are the examples for wasting diseases? Can you quickly think of some examples? Okay, marasmus, PEM, protein, energy, malnutrition, kwashiorkor, beautiful, good. I am happy. You are talking of pediatrics and you are talking of SPM. But from third year syllabus, from second year pathology, systemic pathology, what happens in osteoporosis? What is it that we are trying to focus here? Muscle and the adipose tissue. Okay. Simple example, tuberculosis. Agreed? If you have seen, tuberculosis is very common in India, especially rural India, and many of us are from rural India. If you remember, you have try to recall a patient with Cox. How is he? He is very thin, lean, okay, very weak, very debilitated, hardly any muscle, hardly any mass, hardly any fat. Tuberculosis is a beautiful example. Having given tuberculosis, can you think of some other diseases? Okay, could be, see, what happens in muscular dystrophy is specifically the muscles are affected. But here, think of something beyond. Okay, could be hyperthyroidism. One more simple example is diabetes. Diabetes. Suddenly you will see a person losing weight, he becomes tired, lean, thin, and we get his sugar checked, sugar is 500, 400, diabetes mellitus. Okay. One more very important thing is cancer. Cancer. Yes or no? See, no issues, don't feel disappointed. I don't see anybody being disappointed, but I am telling, don't feel disappointed if at all you are disappointed. You are a third year student. You are interacting very well, no issues. Fine. But as you come to final year or as medicine is taught, you can include more and more diseases under wasting diseases. I am just naming few. One more you can think of here is AIDS. AIDS, HIV. Okay. There again you will see lot of muscle loss, lot of adipose tissue loss. They look very lean, thin and all. So indirectly what are we trying to tell you is, if indicated, acetic acid can be a very good remedy for HIV, for cancer, for diabetes or for PM or tuberculosis. It has its own symptoms. If all those symptoms match, it can be a beautiful remedy. Acetic acid. Okay. Now next very important thing is, I don't know if it is clear, but what I am trying to focus here, the second point is here, many of the complaints in acetic acid is associated with great prostration. Meaning, there is bad weakness, there is bad debility. They get exhausted very fast. Am I clear? They get exhausted very fast. So this is prostration, which is a general character of an acid. In acetic acid also you see a lot of prostration. Any symptom, for example, wasting diseases associated with prostration, diabetes associated with prostration, hemorrhages associated with prostration, okay, diarrhea associated with prostration. Anything you talk of in acetic acid, it will be associated with prostration. Very important. Okay. Now diarrhea. I already gave you one point. What was that point? Diarrhea which is exhausting. डॉक्टर साहब एक बार जुलाब हुआ, खत्म, पूरा खत्म, जो भी मेरे बॉडी में एनर्जी था, जो भी था, सब कुछ खत्म. एंड आई फील सो वीक, सो टायर्ड, सो फ्रस्ट्रेटेड. जुलाब means loose motion, diarrhea. So after diarrhea, if they have they feel very weak, then you can think of acetic acid. So exhausting diarrhea, diarrhea which will exhaust them. Okay, diarrhea which is profuse, and diarrhea which is associated with the typhoid and other symptoms. Copious, profuse, exhaustive diarrhea, you can think of acetic acid. Okay. Now diabetes. Rehearsals are happening. Good, good. Okay. So we will also talk of diabetes. So diabetes again, homeopathy has got a lot of remedies. Fine. I am a man who follow Hahnemannian method. I give more of constitutional remedies. But there are a lot of mother tinctures. There are a lot of things in homeopathy which is used for diabetes. Okay. Now we'll just focus on acetic acid. Recently we had a case of a lady, one of our students' mother, her HbA1c was 7.6. Okay, HbA1c is what? The 3 months average. Okay, and after taking medicines, homeopathic medicines, she was dead against allopathy. She did not wanted allopathy. You give your medicines. We did try 2 medicines, nothing happened, and then we had a retake of the case, again worked very hard, and last Friday or Saturday she had come for follow-up, and HbA1c is 5.6. Okay, I mean it's normal. That's what I want to tell you, because as a third year student you should know what the normal values are. Okay, and then you'll understand. 7.6 is slightly higher and 5.6 is normal. Done. So she was given homeopathic constitutional medicine. What happened? Any confusion? HbA1c, not HP. Okay. See, we call it as glycosylated hemoglobin, meaning 3 months average. Okay, it gives you the 3 months average of diabetes. Fine. Oh, you got confused HP. Oh, from 7.6 it came to 5.6, and this man on the stage is praising himself. It was more, that's why the faces were shocked. Okay, no, sorry. So that's why, as a teacher we should know what to talk to whom. But no, see, I always talk a little higher. I always talk one step ahead, because I want my students always to be one step ahead. You might feel HbA1c, at least few of you out of curiosity after lunch or before lunch, you will at least go through HbA1c. Correct? Fine. So we'll get back. So that case I was sharing, the readings were high, not HbA1c, and glycosylated hemoglobin. Fine. And it became normal with a dose of homeopathic medicine. So what I was trying to tell you is, homeopathy can do wonders in diabetes. I have a lot of failure cases of diabetes. I have a lot of failure cases of diabetes because I did not understand the case properly, and I have prescribed the wrong remedy. Done. So I purposely highlight the word I have used, because it's not the mistake of homeopathy. It was my mistake of giving a wrong remedy, and the patient did not improve. But luckily with this lady we got the right remedy, and it did wonders. Okay. Now acetic acid, what exactly has to offer in diabetes? So there is something what we call it as excess urination, and naturally there will be great prostration, very important. Excess urination, great prostration, debility. They are common symptoms of diabetes. Fine. You can think of acetic acid. Excess urination. Excess urination, naturally they feel thirsty and they feel weak. Common symptoms of DM. Okay. So moving ahead, before I shift to the next slide, what did we discuss in acetic acid? First point we spoke was, okay, we spoke, I mean you are coming from the first slide, good. We spoke of physical appearance, we spoke of ailments from. Second slide we spoke of hemorrhages. From where, what is the character and what is it associated with? Any questions? No. Fourth slide, we spoke of cancer. Cancerous affections of acetic acid. Two areas, lips and stomach. Lips nothing great, stomach what we saw was burning pain. Yeah, okay, very good. That was cancer. Then we spoke of wasting diseases, we spoke of prostration, we spoke of diarrhea, and we spoke of diabetes. Now we'll go ahead and we'll talk of fever. We'll talk of fever. Okay. What is the indication, or when is acetic acid indicated in fever? See, honestly, I have not used acetic acid much. Okay. It does not mean you should not use acetic acid. I told you many times, the beauty of teaching profession is I also get to learn. And fevers, if we get the exact totality, we can do wonders with homeopathic medicines. But when we don't get the right simillimum, it is very difficult. Okay. I will share a small case. You can also interpret this case, and please don't tell acetic acid, because this case I have not given acetic acid. Okay. So we had a small girl, 4.5 years old girl, who came with her dad to clinic with fever. Now, as a third year student, again I am telling you, and my expectations from you are a little higher. But I told you I expect that from you, because I want you to be always on a better place. So what I was trying to tell you is, 4.5 years old girl came to me, or was brought to me with fever. Now simple, how do you analyze? Huh? Okay, fine. One of your friends says, what type of fever? Okay. Okay, fine. You are fresh from your clinicals, so you will talk of continuous, intermittent, remittent. Good, good. Chalo. But what are you basically? What are you basically? You are a homeopath. Don't forget that. I know, a third year student, but simple. Aphorism number 5. Is that over for you? What does Hanuman says? What does Hanuman says? Exciting cause. Very good. I hear it right. Exciting cause. See, fever. First question is, fever since when? Yavaglinda jvara. First question. So fever from yesterday. What is the next question? Why did you get fever? Will a 4.5-year-old girl tell you? Why did you get fever? My sir told to ask. Since when? Since when she'll tell you? Uncle yesterday or auntie yesterday. Fine. Next question. Yak banchora. Father will look at you, she will look at father. The cycle will continue. But that's a beautiful question, but we are asking it to a wrong person. Or if that girl is mature enough, and luckily this girl was very mature enough, I'll tell you what had happened. One day before, the mother delivered a baby boy, a sibling. I know that these people, they're very good patients of mine. So we know the process of delivery, she was due, etc., etc. This girl also was mega excited. Tangi bartale, Tamma bartane, she was mega excited. Fine? But what was the reality when the mother delivered the baby, fine? And when she was taken to the hospital, what had happened? All of them are taking care of the baby. That girl told, all of them are taking care of the baby. Fine? Like mother to naturally, she will be with the baby. Grandfather, grandmother, father, Everybody behind that boy. मेरा क्या, मैं भी होना. So this girl felt very bad. This girl felt very bad. Bad in the sense, one day boy, she almost went physical. Meaning, I'm sorry, what exactly happened, I don't know, but what you need to remember is, she felt very bad. That's what I was asking her. What happened? Uncle, I know her because, from 1.5 years old, she is my patient. She is very free with me, and ಅಂಕಲ್ ಎಲ್ಲ ತಮ್ಮನ ಕಡೆ ಇದ್ದಾರೆ, ಅಪ್ಪನೂ ಆ ಕಡೆ, ಅಜ್ಜ ಆ ಕಡೆ, ಅಜ್ಜಿ ಆ ಕಡೆ, ಅಮ್ಮನ ಪಕ್ಕದಲ್ಲಿ ನಾನು ಮಲಗೋಕ್ಕೂ ಬಿಟ್ಟಿಲ್ಲ, ಬರೀ ಮಗುನೇ ಪಾಪುನೇ ಇಟ್ಕೊಂಡಿದ್ದಾರೆ, ನನ್ನನ್ನು ಬಿಟ್ಟೇ ಇಲ್ಲ, ಅದು ಇದು and all. And then she lands up with fever. Now what is the simple understanding as a third year student? What has happened to the child emotion? Very good. Who was that? Jealousy. Beautiful, I'm happy, good. See, that's why I told you, I always set my standards high. If I was in third year, if you would have asked this, I wouldn't have told. I'm happy you are telling, good. Jealousy. So, ailments from jealousy. What a kitchen? Simple. No, I didn't ask you the remedy. Don't jump to the remedy. Yeah, good. I'm happy you thought of pulsatilla. But what was also happening in this girl was, she was continuously talking. So when I said jealousy, pulsatilla. Now I changed, this girl was talking, so lachesis comes in. And intelligent boys will mix lachesis and pulsatilla. No tension. Pulsatilla jealousy, lachesis talking. Chalo, good. See, but as a third year student, I am happy with your interpretation. See, beautiful observation. That's jealousy. And see how this child has reacted. The child has thrown a fever. Now what happens if she throws a fever? Everybody will come to her. Ayyo, nin kanda, jara banta. See how the body reacts. Okay? And I gave her a medicine, and the medicine, two things I had taken, ailments from jealousy and loquacity. I use another word, delirium loquacious. Don't ask me all this now, I'll explain. And the remedy that comes up is lachesis. Lachesis 1 dose. And next day morning, 102.2 was the fever, high fever. My assistants have seen this case. Next day morning, around 10:30, 11, the mother sends me a WhatsApp message. Thank you, doctor, for your timely help. My daughter has gone to school. You're getting this? Yeah. So what is it? See how beautifully your remedy works. I can share you 2 or 3 more cases where I have failed. One more colleague of mine, her daughter, she had fever. 3 days we gave this, that, this, nothing helped. And ultimately, they should have started antibiotics. I feel sorry, I feel bad because a single dose of a right remedy can do wonders. You get a WhatsApp message or at least you will feel great. But a wrong remedy, when you don't get the case, you miss the patient. Meaning, at least I couldn't help her homeopathically. I did feel a little bad, but we didn't get the correct picture. We couldn't help her. Okay. So, fever, that was a case of lachesis 1 dose. There I did not give acetic acid because she did not have the symptoms of acetic acid. Okay. So now what are those symptoms of acetic acid that you have in fever? So one thing you already know, acetic acid will have debility. Very good. Acetic acid will have debility. One more peculiar thing is, acetic acid is generally thirsty. Mind you, this is very important. During thirst, during fever, there is no thirst. Very characteristic. Thirstless during fever. Okay. Otherwise, very thirsty. Doctor, my child always drinks water, but during fever, she is not asking for water. Thirstless during fever. And fever which is of slow origin. Okay. Slow onset, slow origin. We call it as hectic fever. Not a very high sudden fevers. Okay. Not a very high grade fever. Hectic fevers. Fine. So debility, cough and night sweats. Night sweats. Why night sweats? It's also a very good remedy for tuberculosis. So night sweats, cough, okay, debility, evening rise of temperature, all those things you have in acetic acid. Okay. So fever, it can be a 3-mark question for you. Any of these things can be a 3-mark question. Hemorrhage, fever, dropsy, cancer, diabetes, all 3-mark question. Okay. Is fever clear? Fever, what do you write under fever, or what do you remember under fever? Fever, which is hectic fever, slow onset, and a kind of continuous fever. What is it that you will be underlining? No thirst. No thirst during fever, very important. And night sweats, profuse night sweats, cough, evening rise of temperature, yeah, all these things, fine. Now dropsy. Now exactly an opposite point comes up here. Dropsy with thirst, very good. Dropsy with thirst. Dropsy with thirst. Dropsy without thirst. Jara, good. Epis. See, when you murmur, it talks about your confidence. When you are loud and clear, the voice represents your confidence. Fine? Epis is absolutely right, but why that hesitation? Be loud, be clear, it should be heard. Fine? So dropsy with thirst, especially ascites, or dropsy of the lower limbs, acetic acid. Okay? Something very characteristic with sleep. Fine? Remember this point, very characteristic. What is it is, they can't sleep on their back. Am I clear? So when we look at the position of sleep, acetic acid people cannot sleep on their back. When they sleep on their back, there is some kind of a discomfort in the abdomen. Fine? A sinking feeling in the abdomen. They feel exhausted, debilitated, something like that. So a sinking sensation in the abdomen, and they feel breathless when they are lying on their back. So what will an acetic acid patient do? He sleeps on his abdomen. When he sleeps on his abdomen, he feels comfortable. Okay? There are many patients who come to our clinic, and we make sure we ask them the position of sleep. Each of them have their own variety. One says, I keep my hand there, leg here, fine, leg under the pillow, this, that. They have got a lot of positions they talk of, fine. But there are some practical positions which we can think of with some homeopathic remedies. Okay? And how is it in acetic acid? They sleep on the abdomen. And the ulta martar. They sleep on abdomen. Any other remedies as a third year student? Any other remedy? I don't know, new syllabus, which remedies are over. Now think of ammonium carb, in brackets ammonium carb, okay. Medorinum, a beautiful remedy is medorinum. Eupatorium perforatum, I don't know if it is done. And one more remedy is podophyllum, okay, podophyllum. And podophyllum, when somebody does, you will understand, it is during early months of pregnancy. Early months of pregnancy, they feel comfortable lying on abdomen. Not during 8th month, 9th month, no, that's the confusion, because very clearly written in Allen's note, podophyllum lying on abdomen during pregnancy. Many of us as students, we get confused. Oh, how? We imagine. Fine? Seriously, if you are not imagining, please imagine. And it is not possible. Allah, it is a very uncomfortable position. And a mother, though she knows God has beautifully protected her baby, she will not risk. My baby. Fine, she will not risk. So what you need to understand here is, during early months, must be when the uterus is still a pelvic organ. Naturally, as it grows, it becomes, not abdominal organ, but it extends. So still it is in the pelvis. Must be 2nd month, 3rd month. The lady is comfortable lying on abdomen. Before pregnancy, she was not like this. Sir, an unusual question. After I become pregnant, sir, I have observed that I am more comfortable lying on abdomen. That is podophyllum. Only remedy is podophyllum. एलोपैथी में कुछ नहीं होता है, वो लोग डांटते हैं आपको, ऐसा क्यों सो रहे हो आप, ऐसा सो, fine, but this is what is happening to her, and homeopathy can do wonders, fine. So we'll go ahead, we spoke of sleep, and the last part here is the mind. Last part here is mind, mentals. Okay, I've kept mentals late here or last here. Generally in my class I start with mentals. Okay, but here it's in the end. Many of the mental symptoms in acetic acid comes because of her physical condition. Okay, meaning, see, she's got wasting disease or he's got wasting disease. He's got a chronic illness, he's got cancer, he's got AIDS, he's got uncontrolled diabetes, and his body, muscles, fat is losing, he is losing. So what will be his emotional state? You can answer this. What will be his mental state? Huh? Do you think he will be irritable, he will be angry? Very good. What is it? He will be anxious. What is he anxious about? Health. Ayo, what is happening? Like, I am losing weight. Must be I am suffering with something very serious. So what is that anxiety that sets up in acetic acid is, I might die. If this continues, naturally, 60 kg था, अभी 40 kg हो गया मैं, 20 किलो 2 महीने में, कहाँ गया अल्लाह को मालूम. अब क्या हुआ? What next? Like for example, India ಕಡಿಮೆ ಆಗ್ತಾ ಹೋದ್ರೆ, where will I land up? So I will die. Now what exactly happens in acetic acid? We have many times women coming to our clinic and telling, sir, my health is deteriorating, and sir, I am worried about my children. Okay, this is how women come, and we never think of acetic acid. And you know what they say, sir, मेरा छोड़ो, अभी 60 से 40 हो गया, अभी शायद 1-2 महीने में मैं 20 या 25 हो जाऊंगा, फिर मट्टी में चला जाऊंगा मैं, मेरे छोड़ो आप. मेरे जाने के बाद आफ्टर आई गो, मेरे बच्चों का क्या? So a lady or a man, a patient who is anxious about his children, anxiety children about. Okay, this piece of information, there's a book, Materia Medica Viva by Professor Vitulkas. I have taken it from that book, beautifully explained by him, and he says, the physical disease giving rise to mental symptoms, because physically you are down, you are sick, your mental state goes into a state of anxiety, and you are worried about your children. Okay, anxious about children. The other remedy you should remember, again, as a third year student it might be too early, but please do remember carcinosin. There is a remedy called as carcinosin, which is a nosol prepared from deceased product. We will not go into the details. Carcinosin is also a remedy who is constantly worried about their children. Okay, but the difference between carcinosin and acetic acid is, carcinosin is very selfless. He never thinks about him. And in carcinosin, there need not be a pathology like this. Matlab, they have some grave disease and then they worry. No. Basically, they are like that. With the disease, without disease, they are always worried about their children. मेरा छोड़ो डॉक्टर साहब, फाइन. बच्चों का देखो, very selfless remedy. What is the exact opposite? Selfish. पहले मेरे को देखो डॉक्टर साहब, बाद में मेरा बच्चा है, जा. Right? So that is selfish. Here what? In carcinosin it is selfless. They might be in a serious problem, but then, sir, मेरा बेटा को देखो, मेरा बेटी को देखो. Fine? So that is the kind of concern they have. Very affectionate people. Carc is a beautiful remedy, we will not club things here. But anxiety about children, you should also think of carcinosin. And why is the anxiety coming up in acetic acid? Because of their, very good, because of their physical illness. Something might happen, fine. Some kind of a fear will set in, meaning I might die, fine. And if I die, who will take care of my children? मेरे बच्चों का क्या? This is acetic acid. ऐसा ही बोलते हैं क्लिनिक में वो लोग, ऐसा ही बोलते हैं, fine. Seriously, acetic acid, don't miss it. But if you have to give acetic acid, you should have that pathology. मतलब they are lean, thin, they are debilitated, and सब कुछ खत्म हो रहा है, वो स्टेज में एसिटिक एसिड. ओके, सो बिफोर वी क्लोज, अभी टाइम है क्या? 2 minutes, 5 minutes, okay, चलो. Before we close, we'll try to quickly sum up, or we can have a last activity, and what is that activity is, where, yes, very good, where in clinic or clinically, where is acetic acid indicated? This I feel you can only answer. But very good, diabetes mellitus, diabetes insipidus, mellitus insipidus. What will happen with insipidus? What will happen with mellitus? Mellitus, the pathology is pancreas. Here, anti-diuretic hormone. Where? Posterior pituitary. Correct? Huh? My physiology is very old. Okay. Even today it is posterior only, no? It has not changed. Chalo. So posterior pituitary. Fine. So ADH, anti-diuretic hormone. So diabetes insipidus, diabetes mellitus, simple gastritis, cancer, fine. Epithelioma, ulcers, ulcer in stomach, diarrhea, fever, dropsy, hemorrhages, anemia, meteorrhagia, all these things can come under clinical indications. Okay. Now before I close acetic acid, any quick questions? Anything you would like to ask? One clarity banta. So acetic acid, see, it should be a picture. I mean, it should be a picture. This is how the person is. These are all the diseases an acetic acid person can suffer with. Because of this physical illness, that will be his mental state. They are all related, they are all linked. Fine. Modalities is a chilly patient. So majorly exposure to cold aggravates. And what ameliorates? More than warmth. More than warmth. What was the other thing? Very good. Sleeping on abdomen. I don't know who it was, but sleeping on abdomen. Sleeping on abdomen ameliorates. Warmth ameliorates. Okay. Cold aggravates. Fine. Okay. So exam point of view, 3 marks. Hemorrhage, diabetes, cancer, fever, dropsy, any of these things can come. 3 marks. Done? All clear? Yes. It's more of anxiety. It's more of anxiety. See, fear, what will happen? Okay, fear, what is going to happen? And at the same time, he is anxious about his own health, and in the bargain, what will happen to my kids? If my disease continues like this, I will die. So if I die, who will take care of my kids? So that is the anxiety they have. Fine? Okay? Done? Chalo, thank you. Thank you.